which is the recent election. That's the presidential election. I'm not here to talk about politics, and I'm not concerned about which side of the coin you're on with regard to presidential elections and choices. But what I can tell you is that as a physician and as a practitioner, I've heard far too many people say that after the election, my anxiety level rose. That is simply reflective of what kind of stress we're seeing, not only in our country, but in our cities and our towns, everywhere in the United States and globally. So what is pyroluria? Pyrrole disorder, or pyroluria when we talk about finding pyrroles in the urine, is an abnormality in biochemistry that results in the overproduction of what we call pyrrole molecules. Now, pyrrole molecules are actually very normal byproducts of hemoglobin production and other processes in the body. Now, unfortunately, when these pyrrole molecules undergo stress of any type, that stress can be environmental, it can be physical stress, it can be emotional stress, it can be physiologic stress, such as growth in a child or a teenager, such as cancer, a cold, the flu. All of these can cause a change in the structure of pyrrole molecules to where now they become problematic. And in that problematicity, we have the actual challenge of pyroluria. Once these changes occur, we see that pyrroles tend to have a very strong affinity for metals like zinc and aldehydes like vitamin B6. This can contribute to a zinc deficiency by way of increasing the urinary loss of zinc molecules. Now, please note, excess pyrroles have little or no function in the body and are effectively excreted or reduced or removed through the urine. Let's talk about the connection between pyroluria and zinc deficiency. Zinc deficiency results in altered brain levels of many neurotransmitters, including gamma-aminobutyric acid, we call it GABA. And they can also produce a copper-zinc imbalance that may comprise, or compromise rather, appropriate neurotransmission. That is, how nerves communicate one to another. It's also associated with delayed growth, temper control issues, poor immune function, neurohormonal imbalances, and learning and processing challenges. Let's talk for a moment about the connection between pyroluria and vitamin B6 deficiency. So in addition to the production of neurotransmitters, vitamin B6 is involved in more than 80 different biochemical reactions in the body. Some of you already know that vitamin B6 can be important in the methylation process. Please note, it is not a primary donor of methyl, but its presence is significant in different biochemical reactions that are part of methylation. Pyroluria is huge with regard to oxidative stress. Folks, we have to hammer this message in hard. Let's talk about exactly what this means, okay? First of all, to the practitioners out there, pyrroles in the urine can reflect what is oxidative stress. Oxidative stress, and many of you have seen this picture before, oxidative stress is what it produces free radicals that can lead to cellular membrane destruction at the cellular level. So I want you to think of cells rusting. Think about that old pickup truck that you see in the movies, the red pickup truck, and it's got all sorts of rust areas and there are holes in it, but you know, the guy who owns it loves that car, is not going to give it up. But unfortunately, the engine may be willing, but the body of that car is getting weaker and weaker. Folks, that's oxidative stress. Now, inflammation can cause oxidative stress, and when oxidative stress is present, it further increases inflammation. But pyrroles are very strong reflectors of oxidative stress and inflammation. So when you see very high levels of pyrroles, that can tell you that there's actually a different process that is more organic in nature occurring in that person's system. High incidences of pyrrole disorder can be seen in alcoholism, autism and Asperger's situations, anxiety disorders, antisocial personality disorders, ADD and ADHD, bipolar disorders, criminal behavior, depression, Tourette's, substance abuse, and the list of others that we see here on the screen. But I want to clarify something. Pyrroles don't necessarily cause these disorders. Pyrroles, on the other hand, can be increased because these disorders produce stress on the system. So let's take a few, for example. Okay. Alcoholics, or alcoholism rather, puts stress on the system. Autism puts stress on the system. However, anxiety, on the other hand, may actually be caused by pyrrole disorder. And the same if we go 3 down with regard to bipolar disorder. Many people who are misdiagnosed, or many people can be misdiagnosed as having rapidly cycling bipolar, when in fact, it's actually pyrrole disorder. Depression can also be caused by pyrrole disorder. In the next column to the right, schizophrenia. There's actually about 27% of schizophrenics are actually pyroluria schizophrenics. The schizophrenia symptoms occurred because of pyrrole disorder and usually some type of environmental insult. Mood swings underneath that are often quite regularly dominated by pyrroles. The pyrroles themselves are very rapidly cycling in mood, from anxiety to depression to rage to happiness to tearfulness to impulsivity, sometimes several times throughout the day. So these are very important to recognize in terms of cause and effect. Everything you see here on this screen can have a relationship with regard to pyrroles, but it's usually, for the most part, the disorder causing the pyrroles, except for those we've talked about right now. Criminal behavior, for example, that's a lot of impulsivity, that's a lot of different chemistries. Very few are actually caused by pyrrole disorder. However, those other stressors in that person's or that individual's life may actually increase the level of pyrroles. Let's face it, if you've committed a criminal act and you are being wanted or chased by the police or chased by your unhappy colleagues, I think your stress level has gone up. And I can tell you, you will become pyroluria. Pyroluria depression. We see a double deficiency in zinc and vitamin B6, and that tends to result in low brain levels of serotonin, dopamine, and GABA. This, in and of itself, is a recipe for depression and anxiety. Now, for you practitioners out there, what are we really seeing here? We've talked about neurotransmitters, and we've talked about metals, and we've talked about vitamins. Well, the key here is that we're digging deeper than neurotransmitters, which is what we typically see in psychiatry. We kind of stop the neurotransmitter aspect or the therapy aspect. Here in molecular medicine, we look for the biochemical imbalances as causal. There are other nutrient imbalances that can certainly take place with regard to these challenges. In many cases, depressed individuals have more than just one biochemical imbalance. There's often a genetic or an epigenetic imbalance in a nutrient that can alter brain levels of key neurotransmitters and therefore result in abnormal brain chemistry. Vitamin D deficiency has been associated with depression, schizophrenia, ADHD, and other mental health disorders. Undermethylation has often been associated with depression, eating disorders, OCD, and perfectionism. Overmethylation. Overmethylators tend to have a tendency for high anxiety, panic, depression also, including sensitivities to pesticides, toxic chemicals, and foods. Copper. Now, those of you who know us know we're very, very big on handling copper issues. Copper overload tends to push dopamine and turn it into norepinephrine in the brain. Imbalances here can lead to disorders like schizophrenia, ADHD, bipolar disorder, postpartum depression, and violent behavior. Copper toxic males are often very impulsive, for example. Copper toxic females tend to be very depressed, and they can also have physiologic symptoms like irregular menstrual cycles, horrible menstrual cycles, fibromyalgia, chronic fatigue, and a variety of other issues. Fatty acid imbalances have also been associated with depression, ADHD, schizophrenia, bipolar disorder, and dementia. Folks, what this slide illustrates is that several different biochemical imbalances can produce similar symptoms. The key here is you've got to find the underlying chemical imbalance and treat it. Let's start with some facts and myths about pyroluria. Fact: severe stress is a cause of pyrrole disorder. stressful life events or traumas can increase the associated symptoms and excretion of pyrroles. Myth: omega-3 fatty acids are good for everyone. Folks, omega-3 fatty acids are not good for individuals who've got a decent or strong pyroluria. The reason is that there's a problem in what we call the arachidonic acid pathway, and so omega-3s tend to actually cause inflammation as opposed to quiet inflammation in people with pyrrole disorders. Okay. Fact: pyroluric individuals tend to worsen if given fish oils, DHA, EPA, etc. And once again, this is the arachidonic acid problem here. Myth: pyrrole disorder causes thyroid disease. Now, I know a lot of you out there, and people who are not listening, actually have spent a lot of time trying to fix their thyroid, assuming that pyrrole disorder is actually a direct cause. Folks, pyrrole disorder is not a direct cause. We've treated thousands of individuals with thyroid disease, both in traditional medicine and otherwise. And I can tell you that correcting pyrroles does not fix thyroid disease. Now, some of the confusion may come in that when we look at zinc deficiency and what's called the iodination process that's involved in typical thyroid processing, zinc may be a factor or a variable there. But please understand, this is not causal in nature. So correcting pyrrole will not indeed fix thyroid conditions. Fact: pyrrole molecules in general really don't cause organic disease syndromes. They are in fact more reflective markers of oxidative stress caused by organic disorders like thyroid conditions, like cancer, like sickle cell, broken limbs, colds, flus, and emotional turmoil or trauma. Furthermore, correcting pyroluria in these cases simply will not fix the organic syndrome. And believe me, if it did, I'd be jumping for joy because so many people would be healed just by fixing their pyrroles. But unfortunately, that's not the case. Fact: the symptoms of pyroluria are frequently mistaken for signs of other psychiatric illnesses, mental or behavioral disorders. Misdiagnosis is very common. When an individual is under the care of an experienced physician with appropriate laboratory testing, nutrient therapy treatment can dramatically improve the individual's symptoms and quality of life. Myth: treatment of pyrrole disorder requires a complex of multiple micronutrients. Folks, there are so many practitioners and doctors out there who have not got this targeted. They may include some of the right elements, but oftentimes these treatments are far more complicated than they need to be. The actual treatment to reduce pyrrole disorder or to reduce pyrrole molecules in the system is actually quite limited. When we're doing doctor training globally, I often tell doctors, listen, if you got a patient out in the desert that only has 50 cents and no other money, what are the key elements you need to treat this person? We use surgical precision when it comes to nutrient therapies and molecular medicine, not giant complicated protocols that for the most part may cause more harm in some cases than good. The fact: treatment for pyrrole disorder requires therapeutic dosages of key micronutrients only. Many people have made the mistake of thinking that, well, if they take the right supplements, they're good. No, folks, you've got to have the right supplements with the right dosing, and you have to be aware of other clinical conditions that can affect those dosages. For example, there are quite a few drugs out there that, if taken, can lower zinc levels. One of them is Depakote. There are many proton pump inhibitors that can affect the level of vitamin B6 out there. So if you've got gastric issues and you're taking one of these proton pump inhibitors, you can lose effectiveness in the treatment of pyroluria if you don't have the right dosages and concentrations. Folks, this is why you don't try to treat these things by yourself. This is why you need a good experienced physician. Testing. Pyrrole disorder is diagnosed by finding elevated cryptopyrroles in the urine. Laboratory testing will indicate whether an individual has a numerical pyrrole disorder. Interpretation and correlation of a patient's medical history, symptoms, and laboratory test results together allow for an accurate diagnosis of pyrrole disorder by an experienced physician. Oftentimes, borderline cases are seen by the test result and do not alone indicate nor exclude pyrrole disorder in an individual. In other words, it's neither a yay nor a nay, but you've got to understand the circumstances and other key elements. Mensah Medical utilizes Direct Healthcare Access 2, Incorporated, for pyroluria testing. They're the only lab in the United States that reports both actual, that is uncalculated, and calculated or corrected cryptopyrrole results. The calculated result compensates for concentration changes in the urine specimen, allowing for more accurate test results. Folks, if you're not accurately testing for pyrroles, how can you decide if you've got them, and how can you get treated? Treatment for pyrrole disorder. Individuals with pyrrole disorder tend to do better with their symptoms in as little as 3 weeks to 3 months with appropriate treatment. Ongoing improvements typically continue over the course of 12 months. So folks, don't think that within 3 months you're supposed to be cured, okay? There's a lot more to this process. Please note the treatment myths. For example, manganese, vitamin C, selenium, and several other nutrients are simply not necessary to actually treat pyrrole disorder itself. They may have secondary benefits in helping with oxidative stress and inflammation, resulting from many organic syndromes that produce pyroluria. Now let's talk about some problems here for you practitioners out there. Manganese in small dosages can actually worsen a patient who has hypertension, a patient who has seizure disorders, tics, migraine headaches, anyone who's actually had head trauma of any type. This can increase or rather compromise individuals with a previous history of, say, playing soccer or football. Now, how many of our children have never played soccer in the United States? We didn't get the term soccer mom for no reason here. Parkinson's disease, an actual organic brain syndrome, is actually worsened by the use of manganese. As little as 10 milligrams of manganese in an adult may prove itself to be quite problematic.
All right, so now we are going to review some of the questions that our friends in the Pyroluria Facebook group have shared with us in advance. And after we go through these questions, we'll be taking the questions that you pose to us live in your chat. So to start, Deb asks, will all pyroluria symptoms resolve over time with treatment?
Okay. Deb, the way we would put this is a good question. The way we would put it is that whatever or whichever symptoms are actually produced by the pyroluria should, in the worst case scenario, improve over time. But remember, we don't live in a stagnant bubble. There are lots of life factors, everything from jobs to family to illness, that are just cycling day in and day out. Those areas are all areas of stress. Now, what typically happens is that people will say, you know what, my job hasn't changed, my kids are still screaming all over the house, my spouse is still making me irritable every now and then, but I handle it better than I used to. And I think that's one of the best ways to put it.
Stacy asks, what can you do to alleviate copper dumping symptoms? I am going through this myself right now.
Oh, Stacy, that's a great question, and it's not one that's actually related to pyrrole disorder. Okay, so here you need to call your nurse at Mensah Medical, or if you're not a Mensah Medical patient, give us a call and we can talk about that. But unfortunately, this one is more about pyrroles than copper dumping. I know it's a very big problem, and I'm not trying to minimize that, but we want to make sure the answers are given to you in the proper form.
Heather asks, how do you tell when your supplement doses need changing?
Great question. Heather, when you are moving through periods of increased stress, but the most key thing is, how do you feel? If you're feeling more anxiety, if you're feeling more mood swings, if you're feeling more depression, then that's the time for you to call your practitioner and ask, you know what, something's not right. We need to reevaluate what I'm doing currently and then move on from there. So really let your symptoms be the guide and how you're handling them. Very, very key. Good question.
Madison and Al, and actually a number of people in the Pyroluria Facebook group asked about pregnancy and nursing. So the question is, can you discuss pyroluria in relationship to pregnancy and nursing? I started supplements a few months before, and I was starting to feel a lot better. I had to stop taking some supplements and was unsure of others. Also, folate in particular was conflicting because I was told not to take anything with it. But during pregnancy, everyone says it is very important.
This is a fabulous question. I love this question because we have so many pregnant people around. Gosh, who would have thought to keep human society going, we'd have to actually get pregnant and have children. It's a wonderful thing, and forgive my sarcasm here, but I love you folks, and this is a great question. Okay, first of all, remember we talked about stress. Aside from the emotional construct here, anyone who's pregnant is under physiologic stress. You have a growing being inside of you. That growing being needs nutrients. That growing being will suck every single little nutrient from your body in order for him or her to survive and grow and thrive. This is how the system has been made. You are the vessel, you are the warehouse, you are the food producer for this growing being. As a result, many a mother will actually be nutrient deficient. Now, the best way to really deal with this, if you're thinking about getting pregnant, is to make sure you improve your nutrient health beforehand. Yes, indeed, it's true. Because we do not have scientific studies on the effects of nutrients on pregnancy, the whole idea of taking treatment-level dosages of nutrients during pregnancy is a very big problem. First of all, I don't know anyone who, because of ethical reasons, would actually do such a study. We cannot harm the baby. We cannot risk harming the baby or the mother. So yes, you did have to stop taking your nutrient supplements, and that's simply for the safety of everyone involved. Now, you can take recommended daily allowance levels, in other words, RDA levels, of those same nutrients. There's no problem there. However, you cannot take molecular medicine / advanced nutrient therapy levels of those nutrients. Now, with regard to folate, now, folic acid or folates, whichever ones you want to talk about, the FOLs, so to speak, are there to help prevent babies from having neural tube defects. That is where they may grow up or develop with part of their brain literally missing, or with holes in their brains, or just absolutely poor brain development structurally, not just functionally, but structurally. Folic acid is very key. It is important no matter what the mother's methylation status may be during the first 3 months of pregnancy or during the first trimester. So what we always say is that, listen, if you're not sure about your pregnancy date in terms of when the baby was conceived, you should take your folic acid for at least 4 months while you know you're pregnant. After that, you should stop. So in our world, we know that so much is seen with regard to what folic acid does. Folic acid removes methyl from the system. Children with autism, with Asperger's, with ADHD are often under-methylated. And folate is truly a methyl remover in the system when we look at when it's acting at the level of DNA. So in the nucleus of the cell, for you practitioners, folates don't contribute methyl. They do that in the cytoplasm of the cell, where it's not quite as lethal. But once it gets into the nucleus, it actually removes 10 times as much methyl as it ever donated in the cytoplasm. So in other words, you can turn a normally methylating, developing embryo into an under-methylated little being by taking lots of folic acid during the pregnancy, throughout the course of the pregnancy. So this is why we advise you to simply stop. Folic acid is not bad or good. It does the job during the right phases of pregnancy, but it need not go beyond.
All right, so before we get into the live questions, I wanted to remind you all that you can contact us to see how you or your loved one can become a patient. For information about Mensah Medical's antioxidant therapy for pyroluria, please contact Mensah Medical at 630-256-8308. We would love to speak with you directly. You can also email terry@mensahmedical.com. All right, so now we'll start with your questions. To begin, Karen asks, if a 14-year-old girl has been diagnosed with pyroluria and has been commenced on the correct supplements, how long should it take to see a resolution of her psychological symptoms? Can you expect complete resolution?
Well, you asked a double indemnity question, and that's a very good one. A 14-year-old girl is right in the midst of change and development. She has both physical stressors, as in physical growth. She has physiologic changes, as in the development of cycles and hormonal changes, all of which cause stress in the body, which lead to an increase in pyrroles. The first part of the question is actually fairly simple. Within 3 weeks to 3 months, the pure pyroluria symptoms should be doing better. People should be more calm. Individuals should see a little bit less anger, irritability showing up, per se. Less frequent, that is, fewer outbursts. I didn't say the absolute elimination, because remember, stressors can be ongoing. And come on, folks. If you remember being a teenager, or you have teenagers, you know everything in their little lives is a big deal. Life has ended because our blue jeans have been washed with the wrong detergent and have come out the wrong color, etc., etc. Parents, you know what I'm talking about here. So expect tamer versions of these little people. But as their systems continue to develop, you can understand there'll be more and more stress. So what you're more likely to see are cycles, unfortunately up and down cycles, of increased intensity of mood, followed by calming. But overall, you should see a decrease in the intensity of these symptoms that are being produced from pyroluria.
Thank you, Karen. Stacy asks, what is the difference between B6 and P5P?
Great question. B6 is actually the storage form of pyridoxine 5-phosphate. In other words, P5P is the active version. B6 is the version that gets turned into P5P. So you might want to know why we give both. It's because you want to have a good warehouse, so to speak, reserve of stuff to turn into P5P on a daily basis. You don't want to have to just use it all the time and therefore need a fresh sample brought in. It's kind of like going to the grocery store. You should buy enough of your food supplies for an entire week. But on the other hand, if you do it daily, you make more trips to the store and it's more stressful on the system. Okay? So that's the difference. B6 is more the inactive storage form that gets turned into the active form of P5P.
Thank you. Nayana asks, can we treat pyroluria without a test?
Very, very bad idea. First of all, remember how many different entities can produce symptoms similar to pyroluria. A copper toxic female, for example, can exhibit several of the same traits as pyroluria, in fact, with much more intensity. They can be moody. They can be cyclically angry and irritable. They can be rageful. They can have depression. They can have anxiety. Every single thing I mentioned here are the same symptoms seen in pyrrole disorder as well as copper toxicity. So first of all, if you don't test, you're going to miss the mark. You don't know, you don't have actual proof that you have pyrrole disorder. And you can say, well, I had 21 out of the 32 symptoms that I saw in this book. And well, guess what? You may have 10 of those symptoms because you're undermethylated, and that's what undermethylators have. You may have another 10 of the same things that copper toxic folks have. You may have another 5 that zinc deficient people have. You cannot use symptoms to treat. Otherwise, that's what we'd be doing. Number 2, you cannot actually tell objectively whether or not you're moving in the right direction. See, the pyrrole test gives us a number of values that we use in addition to symptoms that actually guides our treatment. Your pyrrole numbers should be going down. If you never check pyrrole numbers, how do you know if you're moving in the right direction? you cannot gauge by way of symptoms alone. That is very, very poor practice. Now, I get it. If some of you are out there in the rural wherever and somebody has no money and you feel bad for them and you want to just do your best, okay, that's a risk you take, but that can also lead to expense where no expense needs to be had. Nutrients cost money, folks. I think you all know that. If you haven't tested it and know that you must treat, you don't know that you need to buy these particular nutrients, you're moving down the wrong track, if you can help it. So, to be educated, to be informed, and to have proof, that is medicine. And this needs to be handled really by your medical practitioner.
Thank you, Nyana. Anne asks, so should someone diagnosed with pyroluria not take fish oil?
That's a very, very good question. The simple answer would be, if you have a decent or strong pyrrole disorder, and let's just say on our scale, anything over 10 with symptoms is pyrrole disorder. Listen, if you've got a 20, you might as well just put the fish oils away or give them to one of your relatives who you know who doesn't have pyrrole disorder. Okay. If you're really in a 10 to 12 range, 10 to 13, it might depend on how strong your symptoms are, and that's something that you and your practitioner have to sort of discuss. Now, there are also comorbidities. There are other elements that are going on in the system that may require fish oils more importantly than pyrrole disorder requires you not taking fish oils. So, for example, an individual who's got neuropathies or who has nerve myelination issues or neuronal transport challenges in the brain, that just might outweigh the need for omega-6 oils in favor of omega-3 oils in that particular person or individual. So it's really case specific. But when we're talking about just chemistry alone, taken outside of the individual person, then yes, typically speaking, we only use omega-6s. We don't use omega-3 fish oils. But like I said, there are many exceptions to that rule.
Thank you, Anne. Kim asks, what causes the stomach pains almost like contractions in pyroluria? This stopped once I started treatment.
That's an interesting one. There's the stitch in the side where the spleen is located, if that's what you're referencing, and that's likely the reference. And that's because the spleen is a warehouse for blood cells. Red blood cells go through there, they're processed, they're broken down, and when that happens, the spleen can enlarge and get engorged, and that's usually what's causing the splenic pain or that abdominal pain, if you will. But it's usually on the left side, not in the mid-abdomen. If you're having abdominal pain, as in where your stomach or pancreas or intestines might be, that's a different issue. And I don't have an answer for you on that one. That sounds very complicated and individualistic. Okay. But the stitch in the side is because of pyroluria, because of the spleen.
Thank you, Kim. Daniel asks, what is the connection between pyroluria and ADHD? Is oxidative stress connected to ADHD?
Yes, oxidative stress is connected to ADHD. And the whole idea, let's just kind of move through this for a minute here. If you have a poor capacity for focus and attention, if you happen to have hyperactivity, unfortunately, you recognize that this is a problem. You just can't do anything about it. You can't help yourself there. That is an emotional stressor that gets placed on the system. That emotional stressor will indeed lead to an increase in pyrroles. That increase in pyrroles will then deplete the system of key nutrients that can then put more biochemical stress on the system, lead to inflammation, and then that inflammation leads to increased oxidative stress. Now, at this point, you've created a vicious cycle, because now that oxidative stress that has been produced leads to more inflammation. And now that inflammation leads to more oxidative stress, and the cycle gets bigger and bigger and bigger without intervention.
Thank you, Daniel. Brooke is asking a very interesting question. You all have asked great questions so far. Brooke, this is a question I want to know the answer to myself. If anyone can get pyroluria when under stress, is there a genetic version of pyroluria and a version that is caused solely by stress alone? If so, how would treatment differ for each?
Okay, that's a great question, but I want to fine-tune something here. Stress is part of the condition involving pyroluria. That's not a separate issue. They are pretty much synonymous. Okay. The difference involves acquired pyroluria versus genetic pyroluria. Individuals who are genetic pyrolurics come from two very interesting backgrounds. Number one, the Irish. Now, I was corrected the last time I was in Australia training doctors. We had a doctor who was Welsh, and she said, Dr. Mensah, this is an issue that involves individuals who are of a geography, and it's not just the Irish. And so I had to caution myself after that. People from that region, the Welsh, the Scottish, the Irish, tend to be genetic pyrroles. In fact, when you look at what's going on in terms of the problems of the society in Ireland, and we have been there, we've seen this for ourselves, we see a tremendous amount of alcoholism. Okay? We see, and these people are drinking because they're anxious, they're depressed. It's not because they are addicted to alcohol. Okay, that's a different story. But the Irish and the Scandinavians, forgive me, I'm using that term Irish again, are genetic pyroluric populations. So when you encounter them, quite often, you might as well just assume they're pyroluric. It doesn't mean you assume you treat them, but we assume that if they have pyroluria, this is the genetic variety. Now, the acquired pyroluria comes from any condition involving stress. So that's why anyone can develop pyroluria. There are Africans all over the planet who have pyrrole disorder. And those individuals are nowhere near the genetic or epigenetic environmental circumstances of the Scandinavians or the Irish. By the same token, the Venezuelans who have pyroluria. These are acquired states in these cases and typically not genetic. Now, having said that, in the ever so shrinking world where we have Africans marrying Scandinavians, where we have the Irish marrying Italians, it's hard for anyone to say that they are without any particular ancestry. So much of the US population indeed shares genetic coding with individuals who are either Irish or Scandinavian in background. Okay, so that's kind of a long-winded answer to the question.
Thank you, Brooke. Christine asks, if your test results are borderline, hence neither yes nor no for pyroluria, will you still go through supplementation for pyroluria? What will the supplements do if you do not have pyroluria?
Okay, let me answer the first question, the first part of the question first. First of all, borderline only is a reference to the test result itself. It's the practitioner or physician that interprets the test along with your symptoms or lack thereof that determines if you have pyrrole disorder. Finding pyrroles in the urine, which technically is pyroluria, does not always indicate that you are at that highly stressed state. Okay, so there has to be both clinical and numerical values designated in order to determine if somebody has pyroluria. And forgive me, what was the other part of that question?
What will the supplements do if you do not have pyroluria?
Well, first of all, you shouldn't be prescribed the supplements if you don't have pyroluria. We have to be careful because we're typically gauging therapeutic dosages of nutrients to treat the pyroluria condition itself. Some of these can be rather problematic if you don't have the condition, but overall, you might just feel a little bit too good, and I really shouldn't say that. But at the same time, you open the doors for an inability to use certain nutrients for other problems that may arise. So just be careful, and if you don't have pyroluria, don't take those dosages, those concentrations of nutrients that would be assessed for somebody with that disorder.
Thank you, Christine. Kevin asks, the white spots on my fingernails have not stopped forming. after 7 months of treatment. Do white spots stop forming in all patients with pyroluria?
Good question. White spots typically resolve within 3 weeks of individuals who have reached the appropriate nutrient levels. So I have to ask a few questions, unfortunately. Number one, how consistent with your protocol have you been? Have you been taking it daily? Have you been taking it twice daily? Have you been taking the full nutrient complement that has been awarded you, or are you only partially on the regimen? Some people are taking, for example, five capsules per day or in the evening, maybe only at the level of 3. Until you are at absolute therapeutic dosage, you cannot start the countdown. That's number one. Okay. Number two, are you having ongoing stressors in your system? And believe it or not, even with nutrients, food is still important. What is your diet like? Are you taking medications, for example, that could be depleting your system of zinc, like I mentioned before, Depakote? Okay. There are a variety of things that could be causing this issue. And I would say contact your practitioner to find out specifically why you might still be having these white spots. Because statistically, they just shouldn't be there if you're being properly treated for pyrrole disorder.
Thank you, Kevin. Jane asks, what do you consider the highest dosage of P5P and zinc one can take, particularly if they're still not seeing results?
Now, you know, I think the vast majority of people out there know what I'm going to say to that, which is I'm not going to tell you that, because that is something that is handled individually, case by case, reviewing comorbidities, in other words, other problems or other challenges that are present, and it really requires just the individual touch. You and your practitioner have to be the ones to decide that. Okay? There are indeed levels beyond which you should not go, because people can become zinc toxic. People can develop peripheral neuropathies from vitamin B6. There are a host of challenges that can happen, and so I'm not going to put that on the internet waves, shall we say, in part because we really need to know a lot more about your situation, but I don't want any of you guys trying this at home. Okay? Just remember, nutrients are not benign. They can become toxic, and sometimes very quickly.
Thank you, Jane. Cece asks, have you had anyone completely recover from pyroluria and no longer need to take supplements? I am one of those people. I noticed P5P caused my urine to be too acidic and my homocysteine was low. I have tested pyroluria level 5 times and it has come up negative each time.
Well, I'm sort of processing everything you said there, and depending on your age, depending on a variety of things going on, first of all, it sounds like you may not be a genetic pyrrole, and it sounds like you're an individual who likely has learned to manage stress, and there are people who can basically, quite honestly, outthink their stress through meditation, through yoga, and can sort of handle it as they feel it creeping on after much, I would say, after a lot of practice with other therapies that can help them reduce their emotional perception of stress. So if you are a genetic pyrrole, there's some caution here, which is that what has flared up once can flare up again. In fact, as a matter of fact, whether you're genetic or environmental pyrroles, you can still flare up again. It may not be today, it may not be tomorrow, but you have to be aware and always on the watch for it. So if you find yourself with mood swings, with anxiety, depression, worsening, coming back, then you probably need to be back on your supplement program. But you're going to have to be retested in order to find out exactly where your levels are at that time, which may necessitate really a different concentration level or treatment level of the nutrients.
Thank you, Cece. Madison asks, since I have pyroluria, will my child be more likely to have it? What are early signs to look for?
Okay, now that's an interesting question, because are you talking about a child that you already have, which I'm not sure you are? If you're talking about if you have pyrrole disorder, is your developing embryo, fetus, and therefore newborn infant going to have pyroluria? And I would say Quite honestly, the odds are not, unless you're in a very, very stressful environment. The infant is developing, the fetus is developing, the embryo is developing in an environment that is not going to be influenced strictly by your pyroluria state. In fact, you may be pyroluria because of your developing fetus or embryo. Okay? Now, when you're talking about, am I a genetic pyrrole? Well, now, if you're passing down those lovely genes throughout the family and the lineages, then that's a whole other story. The odds are your child may be predisposed. So we love in this culture our lovely blonde-haired, blue-eyed little children. And when Dr. Bowman and I are walking through the airports, go, oh, look at that lovely little pyrrole. And when we see that beautiful, exotic, red-headed young lady, and we go, Irish descent, probably that fiery pyrrole that people often ask the question in the movies, hey, what happened to that fiery redhead? Did you marry her? Well, we see these traits, and those traits can be passed on. It is not mandatory because we are talking about two different lineages, both the donor of the sperm as well as the carrier of the egg. But overall, if pyroluria is running in families, it tends to run in families, and you have a higher chance of passing it on. If it doesn't run in families, just because you acquire it does not mean your children are going to be as equally susceptible.
Thank you. There is a second part to Daniel's question. Are there specific amino acids that would be beneficial to someone with pyrrole disorder?
That's a very good question. And if you're talking about strictly treating the chemistry of pyrrole disorder, the answer is more likely not. Amino acids are just building blocks, they're just bricks. Now, let's talk a little bit more specifically here. If somebody has pyrrole disorder that's related to, say, ADHD, and they have problems with focus and attention, and let's say they happen to be, forgive me, let's not say ADHD, let's say ADD, and they happen to be over-methylated, well, elements like DMAE, okay, might be beneficial, and I know that's not an amino acid, but there are a lot of different constructs that could prove useful. Tyrosine in some individuals may be proven useful for focus and attention, but what we're really dealing with is the condition associated with pyrrole disorder. In the absolute state, there is no amino acid that is used to treat pyrrole disorder. It's usually the vitamin and the minerals that are associated.
Thank you. If someone has schizophrenia and has, Brooke asks, if someone has schizophrenia and has been treating for pyroluria for several years, but is not seeing full improvement, and if their testing does not indicate other biotypes of schizophrenia, what is going on and how can they get well?
That's a great question. Now, this kind of goes back to one of our schizophrenia discussions and webinars. If somebody has or believes they have pyroluria schizophrenia, and their schizophrenia is not doing better, I would actually seek a different diagnosis. And let me explain what I mean by that. A small percentage of schizophrenia is actually produced by food susceptibilities and challenges of the colon, such as Crohn's disease or ulcerative colitis. Allergies or sensitivities to gluten, for example, can produce schizophrenic type symptoms. They are more the minor cases, as in numbers, actual numbers. They're more like 7% of all schizophrenia may be caused by food intolerances, another 7% by bowel disorders. So is there now an autoimmune connection, for example? Do you have an inflammatory bowel disease or disorder? What else may be going on in that individual? Because truly, statistically, if a person has pyroluria as the primary cause of that schizophrenia, those symptoms should have at least improved, if nothing else, if not having resolved. So there may be something else going on that you're not aware of that needs to be evaluated.
Thank you. Jane asks, I heard you say one could see changes at 3 months and expect them up to 12 months. What if you're still not feeling better over a year and a half into the program? I still have major social anxiety disorder, chronic insomnia, and ongoing depression.
Okay, now, each one of those can have multiple, that's a great question, and each one of those can have multiple causes. Okay, social anxiety can certainly be caused by undermethylation. This is why I'm saying we don't go by symptoms alone. So, what is your current methylation status, for example? That comes into play. Issues involving copper can come into play. Forgive me, what were some of the other things that were commented on?
Major social anxiety disorder, chronic insomnia.
Chronic insomnia.
And depression.
Who on earth is going to do well if they're not getting any sleep? Now, unfortunately, insomnia is multifactorial. That is probably one of the major complaints in any doctor's office across the United States and probably globally. Insomnia is a stressor. That stressor actually is what can produce an increase in pyrrole disorder. So once again, treating pyrrole disorder does not necessarily improve insomnia. So what are the other factors? That's the real question. What else is contributing to this insomnia? Because if that's not handled, the stress levels are going to be up on a daily basis. We get more and more fatigued as time goes on. That fatigue leads to more and more emotional and physiologic stress, which also increases pyrroles. So there are a lot of questions there, and I would say contact the office so that we can talk more about that. Okay, give the details to your nurse, so that, or you can give us a call and schedule an appointment to talk. Okay, that's very, very important. You got to find out what's going on here.
Thank you, Jane. Luis asks, what if a 17-year-old has been treated for 18 months and then goes away for an extended period to an environment where taking the supplements is not guaranteed? Is there a length of time before symptoms will increase again, or should he be okay for a while?
Okay, that question I would typically phrase as in someone is going off to college. Okay, we see that quite commonly. Now, forgive me, I don't mean to minimize that point there. If someone is going to a different geographical location, maybe overseas or into the military or someplace, yes, indeed, the progress they've made may hold them for a little while, but if we're starting to eat poorly, stay up late at night, as an example in college, going to parties, not taking good care of our health, which is commonly seen in the first year of college. That's why we often call it the freshman 15, the 15 pounds that freshmen put on in their first semester, first year of college. All those are stressors, and believe me, at some point in time, that person's going to have challenges. It is not going to last a year. It's likely not going to last 6 months. If they get away with this for a good 3 to 5 months, they're in good shape. But usually, by the time half a year has gone by, they're feeling it at that point. Okay, so do your best to help them. If they can be followed up by their primary care specialist, they need to be.
Thank you, Luis. Ruth shares, I have been on the Mensah-Bowman protocol, so to speak, for Pyroluria for 1 year and a half. Is this a normal span of time, as it seems 3 months is the norm?
If you're referring to, first of all, your treatment protocol is ongoing. Folks, let me clarify. There's a difference between time for symptoms to improve versus how long you're going to be on the regimen. The regimen needs to be ongoing. It doesn't stop because your system is genetically not programmed to be able to handle those stressors that lead to pyroluria developing. So the moment you lower the shields, you're inviting the invading army to come back. So the treatment for pyrrole disorder is ongoing. What we've been talking about is the time for symptom improvement, not the time for cessation or stopping of the protocol. The protocol needs to be ongoing.
Thank you, Ruth. Nyana asks, what dose of zinc and B6 would you suggest as a startup? Does it depend on the level of pyrrole in urine? What is the average maintenance dose?
And I'm going to say this again. We don't talk about dosing when we're doing webinars or TV. And quite honestly, we shouldn't talk about dosing in books either because we don't want you to do this at home. There are a variety of factors that come into play, such as medication, a variety of factors that come into play, such as intensity level of the pyrroles, and quite honestly, who are you? Are you a senior citizen? Are you a child? Are you a teenager? Are you an adult? Do you have a job? Are you unemployed? Do you have a wife and 3 kids, or a spouse and 4 dogs? Where are your stress points? What are the concentrations? There are about 1,000 variables. Okay, a little bit of exaggeration. There's several variables that come into play in determining what the dosing is for a given person. So there is no simple answer to that. It's very case-based.
Thank you, Nayana. Madison asks, after I give birth, should I be tested again for levels and adjust what I was taking before pregnancy? Can I go back on my supplements while breastfeeding, or should I wait until after?
Yes, no, and yes. Thank you very much. First of all, after you deliver the baby, if you intend to not breastfeed, then it's a good time to retest your chemistry, check for where your pyrrole levels are, and then determine whether or not your old supplement regimen is still useful or if you need new dosing. If you are breastfeeding, you might as well save your money, because you cannot take those high concentrations of nutrients while breastfeeding. Folks, we have to put the baby first. We do want to make sure mother's sanity is intact, but there's a balance there somewhere. In the worst case scenario, we don't want to do anything harmful to the baby. So we cannot say that while you're breastfeeding you can take your supplements. That you simply can't do it. You can take recommended daily allowances of those supplements, but certainly not, the ultra high levels that we're using in nutrient therapy. Okay. Once you stop breastfeeding, and after delivery, and when you stop breastfeeding, then you can go ahead and you can even start your old regimen, but get tested first. And then when we have results, we can update your old regimen. There are a variety of ways to do it. But remember, baby safety first, please.
Thank you, Madison. Lorraine asks, can you cite a specific Pyroluria research article for me to share with my hematologist who does not believe in it?
Okay, there's several articles out there, and I would certainly reference not only the Walsh Research Institute, but also the Mensah Research Institute on disorders involving B6, zinc, pyroluria, etc. But here's the deal. Unfortunately, your hematologist is likely not going to believe it no matter what, because he hasn't really been indoctrinated. It'll be you and several other individuals who bring this up to him or her, and after you've watered the tree and somebody else says, water the tree and water the tree, then they may turn around and begin to consider investigating this phenomenon. Okay? But overall, it's pretty much not going to be of convincing a variable here. Many hematologists and many oncologists and many physicians all over the world still don't believe pyroluria exists. And we usually tell them, well, maybe if you'd open your eyes, you might see that it does. Okay. These are researched in, especially in the Journal of Orthomolecular Medicine. Pyrroles are certainly referenced there. And now in many nutritional journals, pyrroles are mentioned there. And in quite a few research journals now, the concept of nutrient imbalances is all over the place. Many people won't recognize it, but SAMe is a nutrient. Yet it sits there in the Journal of American Medical Association, probably one of the largest journals for medicine globally. So nutrients are there, they're not going away. Our doctors have to be re-indoctrinated, because unfortunately, the first thing we learn in our first week of med school is that nutrients make very little difference in anything we do. And if that's what you hear for 4 years in training, and that's what your attendings are practicing, believe me, you referencing one journal article is not going to make that kind of a huge difference. But send them off to the Journal of Orthomolecular Medicine. That's the best and first place to start for an objective perspective.
Thank you, Lorraine. Luis asks, if only diagnosed at age 48, what are the most important vitamin and or minerals to concentrate on first, as I understand it takes longer to treat when diagnosed when older?
First of all, I want to know who told you that. That's not correct. Um, Pyroluria how old are you?
48.
Okay, first of all, 48 is not older. It's older than 47. Okay. Um, if you were 102, now let me tell you, my oldest patient is over 98 years old. Actually, at this point in time, they're over 100. God bless their hearts. Um, and I can tell you, age responds no slower to the treatment of pyrroles. As a matter of fact, let me share something interesting with all you folks out there. People who are older, and I mean in their 70s and 80s and above, you know, they tend to be so lackluster, and we think that, gosh, they're just demented, they're depressed, or this or that. Do you know what many of them are? Many of them are actually nutrient deficient. Let me tell you an interesting story. It'll be quick, because I know Dr. Buford here is edging me on here. But we had a patient with Alzheimer's in a small town in western Illinois called Sterling, Illinois. And one of the things that I was doing was to certainly begin the process of helping her depression by giving her some zinc and vitamin B6. Now, this is a lady who was just kind of sedentary, didn't talk much, didn't do much. 2 weeks later, I got a phone call from her daughter. And her daughter said, Dr. Mensah, I don't know what you did to my mom. Excuse me, it wasn't her daughter, it was her niece. I don't know what you did to my aunt, but the whole family is talking. My aunt won't shut up. This lady who once would simply not talk, she gets her hair done now. She goes to the store. She wants to go to the mall. She wants to shop. She wants to call and talk. This is a totally different lady. What we're seeing quite often here is a very rapid response to what was a nutrient deficiency by simply providing the right nutrients to an individual. The treatment of pyrrole disorder is not going to be hampered simply by age, and certainly not for somebody who's under 50. In fact, 50 to likely 75 or 80 is no big deal. Oftentimes, people who are in their 70s have GI issues, gut issues, and so they may be taking an additional acid or medications that can affect absorption and things like that. But outside of that, you, a 47, 48-year-old individual, you should be responding no differently than anyone else at any age. In fact, probably better than the kids, because kids tend not to take their supplements too terribly well. They hide, they sneak, and you have to be really vigilant with them. So, no, I think you've been misinformed somewhere. You did not respond slower statistically than anyone else.
Thank you, Luis. Anne asks, is pyroluria hereditary? Can it run in families? How about copper toxicity?
The answer is yes and yes. Pyrroles certainly can run in families. Now, here's the very interesting thing. We've talked a lot in this webinar about genetic pyrroles and if you're Irish or if you're Scandinavian, but let's talk about situations where there's just a great deal of stress generationally in the household. I hate to put it to you this way, but gosh, you know what? Great-grandpa was a jerk, and he didn't treat great-grandma very well. So the kids were under stress. They became pyroluric. They learned from great-grandpa, didn't treat their families well, and the cycle gets perpetuated. Okay, this is what we call heritable environmental stress, and can lead to generations of pyrroles that are actually acquired perhaps very early. It might actually change, the behavior might actually change some epigenetic markers, whereby now difficulty in processing the very nutrients involved in pyroluria may actually become hereditary. So yes, the question is, might it someday turn into something that's hereditary physiologically? The answer is it's possible. Is it probable? Not likely. But we do know that environment tends to be passed on from one generation to another. That is, how we treat individuals. It's great when we can stop that cycle But unfortunately, so many people that we talk to are second generation, third generation, unfortunately, poorly treated individuals from their own families.
Thank you, Anne. Nyana says, we are in New Zealand and we do not have local lab testing. I understand it is a sensitive test to send overseas.
Okay, I was kind of anticipating that one of our colleagues and friends from around the globe would be asking a question about testing. There is only so much we can do, and we are indeed truly relegated to knowing what we know. And unfortunately, if we don't have testing, we can't truly gauge treatment appropriately. And what I would suggest is that you give us a call at Mensah Medical, and we will talk about that privately and how we can perhaps figure something out for your practitioners, because many of them will work with individuals who are in some part of Australia and kind of manage the situation from there.
Amy asks, thank you, Nyana. Amy asks, once going through the treatment for a period of time and you have become stable, is this continued through life?
Yes. Yes. You do not want to go back to what it is you were before. And I can tell you there are going to be stressors throughout life. And one of the key points to be made is that you'll be happy you were taking your nutrients so that you can actually handle those stressors better. If you stop taking your nutrients, that armor is going to start to crumble, and over time something will likely challenge you to the point of detriment. So stay on your program, ongoing.
Thank you, Amy. Chris asks, and what about omega-6, evening primrose, or flaxseed oil? I'm thinking he means this as a treatment.
Okay, those are, if you're referencing treatment, those elements are adjunctive. They are not the primary treatment modalities. You do need an omega-6. I would actually leave the flaxseed oil out. Evening primrose oil, yes, certainly that's part of it. I'll just say it, some individuals prefer borage oil. Tends to be more effective, but not as consistent as evening primrose oil. And that's why we tend to choose evening primrose oil as the oil that is given for pyroluria. That much I will tell you folks out there. But other than that, I'm not sure I quite get the rest of the question.
Okay, Chris, you can leave another comment in the chat if you want to clarify or add anything to that question. All right. Jane asks, so no omega-3s for pyrolorics? Question mark.
Okay. Jane, rarely do we say always or never. And what we're really talking about is in the vast majority of cases, each one being individualistic, we highly recommend only the omega-6s. Now, once again, individuals may have other conditions that may tend to truly warrant omega-3s, and that's, once very, very case specific, we have to see with that individual person. But overall, the rule of thumb, when we're training doctors, somebody has pyrrole disorder, it's an omega-6. Plain and simple, until proven otherwise. So.
Thank you, Jane. Kim asks, why do some pyrolorics have low ferritin levels, anemia?
That is a very, very interesting question. And quite honestly, the first thing that we talk about is that anemia is a common condition with or without pyrrole disorder. So certainly people can have anemia and pyrroles. In fact, anemia is a condition of stress on the system. You don't have enough hemoglobin circulating through the system. You're not getting enough oxygen technically to all the tissues. You may actually see, by the way, now here's where it gets physiologic, so listen please. When you have anemia, you may actually see an increase in immature red blood cells. Those immature red blood cells will not carry enough oxygen. They will not be functional, and they are more what we call friable. In other words, they will disintegrate more rapidly. Now you've got more red blood cells that are broken down that can release their inner pyrroles. And so you can see pyrroles rising because of the anemia. And that's the actual mechanism that happens there. Okay? So there you go. That's the correlation between anemia and pyroluria potentially.
Thank you, Ken. Lorraine says, I seem to have a bottleneck in B6 metabolism, having high levels, even when off of supplements for a month. Can this affect pyroluria treatment if I'm not metabolizing B6 efficiently?
Okay, if you're looking at blood levels of vitamin B6, there aren't any truly 100% accurate vitamin B6 tests out there. They've gotten better, but they're not there to the point where we can use them reliably. That's number one. Whatever your levels are, if you have pyrrole disorder, you don't have enough. And so that's why we provide the increased dosing of the dosing. That's why we don't worry about what standard levels of B6 are in your system. Because whatever it is, it's not idiosyncratically or otherwise, it's not protective for you against pyroluria. So I wouldn't worry too much about the B6 levels. I would be more concerned about whether or not your pyrroles are resolving and what your symptoms are doing.
Thank you, Lorraine. Lana asks, how does HRT, hormone replacement therapy, relate to what you do?
Relate to what we...
I believe she's speaking to the treatments, but Lana, if you would like to clarify your question about HRT therapy, you can post it again in the chat.
Okay, hormone replacement therapy tends to have a lot more to do with perimenopausal conditions. Sorry, and that's a situation certainly of stress, but that has a lot more to do with copper toxicity than it does, or copper elevation, than it does directly with pyrroles. That would be more of an indirect, lengthy mechanism for discussion. But there is no direct correlation between the two.
All right, thank you, Lana. And as I mentioned, you can feel free to clarify that question and pop it in the chat. So before I get to the next question, I want you to know, Dr. Mensah, that Gabby says, be nice to the Irish. They are listening.
Gabby, I'm just going to say this. When we were in Ireland, the Irish were very, very nice to us. And I found it very interesting when Dr. Walsh and I and Dr. Bowman landed in the airport. And the first thing that hit me was, gee, I don't know if I could ask anyone if they've seen Dr. Bill Walsh around anywhere. It's kind of like, okay, is Mr. John Smith available in the United States? But yes, we'll be very ginger with the Irish. And please remember that we're only speaking biochemically about the Irish, not in terms of emotionally or our love for them. We love all our people everywhere.
And thank you, Gabby, for calling Dr. Mensah out on that. Georgianne asks, she asked a question about some issues I cannot pronounce correctly, but I'm going to try. What are the differences between phosphatidylcholine?
Phosphatidylcholine.
Okay, and get ready to correct this.
Phosphatidylserine.
Yes. And omega-3s and omega-6s. Which ones are best for the brain?
Okay, these are all different creatures. Now, anything that is a phosphatidyl is actually a membrane branched branch chain acid that is used for membrane stabilization. That is very different than omega-3s and omega-6s in how they work. Omega-3s and omega-6s have more to do with fat and myelin, the cholesterol aspect of the neuronal sheath, as we call it, the network of fatty tissue that surrounds a nerve to make sure impulses get transmitted properly. Phosphatidylcholine and phosphatidylserine, and another one known as phosphatidylethanolamine, I lovingly call them the 3 phosphatidyls. Their job is to actually escort fatty acids from one side of the cell membrane into the other. So many of you may not get this reference, but I'm going to try here. If you've ever seen professional football, and you've seen the guy, maybe he's called a running back or somebody who grabs the football, and you see him running down the football field. Usually he will cup the football into his arm in one hand on one side, and then he will sort of run with his hand outstretched on the other side. So it looks like he's cupped the football like somebody is clutching a purse with just one hand. Now I bring up this analogy because that's what phosphatidyls do with fatty acids. Phosphatidyls cup fatty acids and transport them across the cell membrane, if you will, from one space into a different space. That is the function of phosphatidyls. Now then, omega-3s and omega-6s are fatty acids. They are the targets, or shall we say, they are the points to which phosphatidyls look to grab, cup, and carry. So they're structurally and functionally different agents. They're not synonymous. They're not interchangeable. They have very different functions.
All right, so we are approaching the time that we originally allotted. However, we will be staying on a little later until about 8:45 p.m. And we want you to know to be sure that you're checking your emails from Mensah Medical, because Dr. Mensah will be having a Facebook Live session next week where we will be able to address some more questions there. So if you aren't able to get to your question tonight, make sure you are signed up to our newsletter at bit.ly/MensahMedNews, which I will pop into the chat, and you'll know when our next Facebook Live session is. Okay, so Lana asks, can genetic pyroluria be healed, or is it chronic?
That's a great question, Lana. Genetic pyroluria is chronic. You have to always be on the lookout for it. It may be quiet now, but any increased stressor in the system, in your life, in your environment, can awaken this sleeping dragon.
Jane asks, just finished trialing 4 months of methionine while staying on SAMe with the purpose of being able to go off the SAMe, but not feeling at all ready to let go of the SAMe. Is methionine just not enough in some folks? Been as consistent with all supplements as the day is long.
Okay, I want to be very clear. That question does not have anything to do with pyroluria. Okay, so I want us to be very clear about that. And I would say, please contact your nurse at Mensah Medical tomorrow so that we can get that answered immediately. There is an answer, but I don't want to confuse folks by talking about those other elements. They don't have anything really to do with pyrrole disorder treatment.
Deborah asks, how young an age can pyroluria show up?
Now that's a great question. The question is, unfortunately,
and she she asked toddlers and infants, for example.
Yes, we don't really test before the age of 2. Now, would it be fair to say that it's possible that our infants have pyrrole disorder? Certainly, it's possible, but we don't test and therefore we don't treat before the age of 2. For a variety of reasons, but we just say that it's possible on the one hand, but treatment really begins at age 2 or 2.5.
Thank you. Hannah asks, can misphonia be connected to pyroluria? Will treating pyroluria help misphonia?
Who's this?
Hannah S.
Hannah, it's funny you bring that up because quite literally, I was talking to one of our nurses today, and she brought up somebody who had misophonia, and I was sort of chuckling, and I said, well, you know, it's interesting how our psychiatric and psychological world come up with these lovely terms that really reference pyrrole disorder, or a strong tendency towards that. Everything from, what was this one, intermittent explosive disorder to misophonia. Quite often, if it's not really pyroluria, pyroluria is a component of that disorder. So indeed, misophonia can be helped in many cases or partially helped in others because it's really related to pyroluria from a biochemical perspective.
Thank you. Daniel asks, why are pyrolurics poor processors of arachidonic acid?
Yes, that is a loaded biochemical question. The way I would put it is that, quite simply, the wires are crossed. In the person with pyroluria, the arachidonic acid pathway moves in two directions. It sort of splits and goes in two different places. One leads to inflammation and one leads to anti-inflammation. Quite typically, the individuals who are not pyroluric, omega-3s are beneficial and they are anti-inflammatory. In those who are pyroluric, the wires get crossed. Now what was in the old days or previously anti-inflammatory becomes pro-inflammatory. So if you've got an inflammatory condition that's increasing pyrrole disorder, you don't want omega-3s because they make the inflammation worse. You want omega-6s, which typically are pro-inflammatory. Now in a pyroluric, they tend to be anti-inflammatory. That's the really simple answer.
Georgia says, thank you, Daniel. Georgia says, I have been treating pyroluria and overmethylation and have seen improvement. I still have some fatigue and need rest midday. Also had chronic Lyme disease. Is fatigue a symptom of pyroluria?
Fatigue can be, but indirectly. If you don't have enough zinc in your system, you may not have a whole lot of pep. If you don't have a lot of vitamin B6 in your system, you certainly may not have a whole lot of pep in your step. It is quite possible. But vitamin B12 levels are also important there. You also need appropriate vitamin D levels. Fatigue, you may also have copper toxicity or an elevated percent free copper. So there are many different biochemistries, let alone hormonal regulation challenges like thyroid disorder or adrenal fatigue that can all come into play. But certainly many of the B vitamins, B12, B6, P5P, can directly affect energy levels. Listen, if I had known about vitamin B6 when I was in medical school, I wouldn't have spent so much time wrecking my brain drinking Pepsi because I didn't drink coffee. And I would have just been popping the B6. I would have stayed awake all night. Okay, so they're very, very powerful. If you're thinking energy and fatigue, that's where pyrrole disorder and that connection comes into play. Potential lack of zinc and B6 independently or together.
Thank you. Christina asks, what are the actual genetic SNPs driving genetic pyroluria?
Oh my goodness. Okay, that's a really loaded question, which quite honestly I'm going to bypass for now. If you want to discuss that, let's talk molecular science more or less one-on-one. Send me an email and I'll address that question. The genetic testing that's out there right now with regard to the 23andMe and the MTHFR don't address that. So it's not a simple go out and look for the SNP kind of a deal.
Thank you. Kevin asks, does blood type affect response to treatment?
That's a great question, and it sounds like somebody was reading Dr. Walsh's book. Quite typically, people will say, well, you know what, type A blood type tends to respond slower. Now, I want to put some things in perspective. When we talk about type A individuals, I don't mean personality, but blood type A responding slower, that can be only a matter of hours to days. We're not talking about weeks or months. So it is really statistically not significant when it comes to actual treatment time. And we're not referring to pyrrole disorder, by the way. We're talking about nutrient therapy in general. And that can shift by a variety of complicating factors, both in terms of actually expediting treatment to, treatment responses, to prolonging treatment responses. The number one variable for success with nutrient therapy is patient compliance. That's the number one thing. You take your programs the way you're supposed to take them, just wholeheartedly, full speed ahead. That is going to be the limiting factor for you getting better. Okay. assuming you're with a practitioner who really knows what they're doing, quite honestly. Okay. Which is a lot of them, by the way.
Thank you. Deborah asks, will supplementation lower pyrroles? Do pyroluria symptoms correlate to the level of pyrroles in the body?
The answer is yes and yes. However, in borderline cases, when somebody is somewhere between 10 and 15, the level of intensity may not truly reflect the level of symptomatic intensity. So some people who've got a 12, for example, may be far more anxious than other individuals who've got a 25 as a pyrrole number. So it's not always a hard fact that the level of pyrroles dictates intensity. But for the most part, now if you've got a pyrrole between 25 and 45, that's usually a more intensive symptomatic pyroluria.
Thank you. And I believe this is actually going to be our last question. As I mentioned, everyone, please make sure you're signed up for the Mensah Medical newsletter to know when we will have our next Facebook Live session and more webinars like these where you can speak with Dr. Mensah directly. All right, so the last question comes from Kim, and she asks, should zinc be taken in the morning or in the evening?
Great question. Zinc should usually be taken in the evening for practical considerations. Number one, zinc and B6 together can put together quite a punch. And since B6 is typically taken in the morning, you probably want to take your zinc in the afternoon or evening. Number two, most of the time dairy products that contain calcium tend to be taken in the morning or at lunchtime. Calcium can actually retard the absorption of zinc. So you typically want to take your zinc at least 3 to 4 hours away from your calcium. So for practical considerations, we usually suggest you take your zinc in the evening, not in the morning or at noontime.
All right. Thank you, Kim, and thank you, everyone, for joining tonight's webinar. We want you to know that we would love to meet you in person in Fort Lauderdale. Dr. Mensah and Dr. Bowman will be there June 27th and June 28th. Also, if you are in the Illinois area, our main clinic is located in Warrenville, Illinois. So you can visit us in person with any questions there. And also visit our website to learn about regional outreach clinics near you. Our doctors do travel all over the country. Oh, Dr. Mensah has one more comment.
Yes. I want to thank everyone for participating in tonight's webinar. I want everyone to know that we are always looking progressively forward, and there are a lot of issues that we're going through in science now with regard to reproduction, with regard to adoption, with regard to the science of manipulating the DNA of our future children. These are issues that we're going to actually have an upcoming webinar about, and Dr. Kathy here doesn't yet know it, but Dr. Bowman gave a wonderful presentation in Australia not too long ago, along with Dr. Liz Mumper, a prominent pediatrician and author of chapters in our board review series programs for our national board exams on similar topics. It was something that we put together that we felt was extremely important, and I want everyone to be on the lookout for this webinar that will likely host in the next 3 to 4 months that involve everything from knowing your mate and their families to looking at what potentials are for adoption, to, in other words, keeping your eyes open, but more importantly, genetic manipulation. Folks, it's not as simple as somebody is being a surrogate. You are introducing foreign DNA, you're introducing foreign epigenetic factors into your potential child. So this is something we take very seriously, and we think it's about time that people became very aware about what to look for, how to make the right decisions, and at least to walk in with your eyes open. Very, very important and dear to our heart kind of scenarios. Unfortunately, we have to tell you, your child is not always only your child.
All right, and I want to remind everyone that you can make an appointment to become a patient at Mensah Medical. contact Terry at mensahmedical.com to learn more. You can also call us at 630-256-8308, and we would love to hear from you. Thank you again for joining us tonight. And also, if you have any questions, you can email me at Catherine@mensahmedical.com. Also, be sure to follow us on Facebook, where we share a lot of great information and resources for you all, and we also keep the conversation going there. So be sure to follow us at facebook.com/mensahmedical as well. Thank you, everyone.